So let's go ahead and get started. I really want to thank everybody for making a few minutes to join today's webinar. And I want to start where I always do when talking with our aging and disability networks and grantees, to really recognize and thank you for the incredibly important life-saving work that y'all have done throughout the pandemic. You have truly made sure that no one is left behind during COVID. From the work you've done to helping people access vaccines and boosters, to the work now on ensuring access to tests and N95 masks. We know, particularly for the communities that we serve, that it is critical to reach people where they are, particularly when people are in underserved communities. And that's why last month, ACL launched a partnership with the Health Resources and Services Administration, HRSA, to help distribute tests and masks to older adults and people with disabilities. You all should have received a letter from me and from HRSA's administrator, Carol Johnson, last month, explaining how ACL's Aging and Disability Networks can now partner with HRSA's community health centers and rural health clinics to get free N95 masks and at-home tests to distribute to our communities. Some of you may already have partnerships with community health centers and rural clinics, and for others, this may be a new relationship. But what I want to say on behalf of both ACL and HRSA is that we are working very hard to make sure that each of our networks knows what the other one does and how to find each other, and really the importance of this collaboration of our networks to both of our agencies and the work that we are trying to do to center health equity. I really want to thank all of you who have already begun this partnership to deliver masks and tests. We got information from HRSA maybe a week or so ago, and it sounds like 20% of the community health centers and rural health clinics participating in the mask and test programs are already partnering. For those of you who have not yet partnered, I really want to thank you for being here today to learn more about this opportunity and to really encourage you to take advantage of this opportunity. So with that, I would like to turn it over to Michelle Wojcicki from HRSA's Bureau of Primary Healthcare to talk about this program and how you can work together. Michelle?
Great. Thank you so much, Allison. I really appreciate the opportunity to be here with you today. As Allison mentioned, my name is Michelle Wojcicki, and I am an analyst in the Office of the Director within the Office of Quality Improvement at HRSA. And I'm going to provide a brief overview of HRSA's Health Center program broadly, which many of you are already familiar with. But to orient everyone generally to our work, and then dive into a few COVID-19 specific programs at HRSA that, again, Allison mentioned, these are the direct allocation programs. Next slide, please. So first, just a quick orientation on our mission with health centers in communities, as you likely already know, as many of you are already working with them, which is wonderful. The main centerpiece here is public health support. And so through these health centers, HRSA seeks to improve the health of the nation's underserved communities and vulnerable populations by ensuring access to comprehensive, culturally competent, and quality primary health care services. A few details of who is included in this health center network. There are nearly 1,400 health centers with over 13,000 site locations across the country who work daily and diligently to provide on-the-ground, local, and integrated primary health care to their communities. This happens through direct primary health care medical services and also supporting services like case management and transportation. So in total, health centers serve about 1 in 11 people in this country, and 1 in 3 of those individuals are in poverty And there are special focuses throughout our health center networks on populations, including veterans, individuals in HUD-assisted housing, the elderly, and rural agricultural workers. During the pandemic, health centers have been key in combating the pandemic and on the front lines, working to ensure that these populations, patients served, and their communities have equitable access to treatment, testing, masks, and vaccines. Health centers have been supporting the public health response in conjunction with local and state jurisdictions, along with providing that direct care for the management of mild COVID-19 symptoms to help relieve burden on their local hospitals. Health centers have also received a number of different funding streams from federal COVID-19 funding. I'll speak in a moment about the direct response tools that Allison mentioned that we have to combat the disease. But I also want to highlight for a minute another funding stream from the 2021 American Rescue Plan, which includes health center construction and capital improvements. These were one-time funding awards that have been provided to health centers, over $950 million to over 1,200 health centers that are being used for construction, renovations, and other capital improvements that can modify, enhance, or expand the health center's infrastructure. Health centers must always follow the federal accessible design requirements under federal law, but these ARP funds may be specifically used to include and improve accessibility related activities. So I just wanted to highlight that aspect of the federal funding as well for you today. And now, next slide, please. To turn directly to the allocation programs for the response tools. In order to ensure equitable access to communities and vulnerable populations, HRSA has been making available direct allocations of specific COVID-19 response tools to health centers in your communities. These are in addition to other jurisdiction allocations of these items and locations that may be available through other healthcare providers. So first, vaccines. Vaccines are available to all health centers to order. These include all of the FDA approved products, including both for adults and pediatrics, and the boosters and primary series. Health centers have been providing these on site at their primary locations, in mobile clinics, at family vaccine events, school-based clinics, to name just a few. And then there are three newer, I guess now as we come into another spring, maybe not as new, but slightly newer starting from last spring, some other response tools made available to health centers. These are first, the testing supplies, and these include now two products, excuse me, two products. The first are at-home self-test kits that can be passed out to patients and the community to keep on hand whenever they need to self-test. And so these can be really used anywhere in the home, out in public, any environment. They are rapid tests that are, the easy swab and can be self-administered, or with the assistance of another individual who does not need to be a healthcare provider. And then secondarily, we have newer products available that are meant for provider assistance. These are called point of care diagnostic tools, and it consists of an analyzer, a handheld digital device that a provider uses, and a testing strip. So the procedure is similar, the swabbing and using a little test with a reactant that gets inserted into the machine. These are also quick, provide quick results, but the provider does need to use those. But they can be done in multiple settings as well, a mobile clinic, or the provider's office. And these can test for COVID alone and also the flu. So it provides the provider, with an additional tool, particularly during flu season, to try to pinpoint where, what the symptoms may be stemming from. And then thirdly, therapeutics for the treatment of outpatient treatment, of mild to moderate COVID-19. HRSA has recently expanded these products to all health centers that have pharmacy capabilities. And then finally, N95 masks that are available for all health centers to order. These can include pediatric and adult masks. So as Allison noted, we are encouraging partnerships between health centers, rural health clinics, and ACL supported networks to distribute these free products to older adults, people with disabilities, and others at greatest risk for COVID-19. ACL, Mr. Nichols, recently spoke at a webinar with health centers participating in our testing and mask programs to make sure that on the health centers end, they are aware of you all out in the community as potential partners if they have not already partnered with you. And we've been providing the joint HRSA ACL letter repeatedly through multiple HRSA communication channels to our stakeholders. We want health centers to be informed, to proactively reach out to you as potential partners, and to also have this context when you knock on their doors as a partner as well. And so I'm sorry, can we go back one slide? Yep, perfect. So what you see here is the Find a Health Center link. This is the best way to identify local health centers in your area. And we encourage you to use this tool to support your efforts for partnerships in the community. There is also, HRSA specific COVID-19 information on the website, HRSA website as well, including some information about health centers participating in certain of these programs. There is not a testing specific program page, but we do have over 1,000 health centers currently participating in this program. And it just takes a few steps for a health center to take the steps to get onboarded into our online ordering system if they want to newly start participating. So in the circumstance that you meet with them and talk about a partnership, but they say they're not onboarded yet, it is a easy process to get them onboarded if they would like to participate. You can also reach out to your local rural health clinic or contact the National Association of Rural Health Clinics. And I can put these links in the chat as well to identify rural health clinics in your areas. And so with that, I will stop there. The last slide are also links to our some HRSA specific information, including signing up for newsletters that we send out to our health center stakeholders. And this is one of the venues that we share information about these programs, but you are also welcome to receive that information as well.
Great. Thank you. Thank you so much, Michelle, for those slides, for that presentation. And I want to invite folks to put any questions that they may have in the chat. I see that we got one and someone answered it, and I'm not sure which program this was referring to. The question was, is this program for healthcare providers? We are an ADRC and a AAA. If this is about, can you participate in this partnership in getting masks and tests, it's absolutely for our ADRCs and for our AAAs. But Michelle, I don't know if you have a different answer. I'm not sure if this question was specific to something else that you were mentioning being done through health centers.
Yeah, so I would just, frame it this way. The programs are set up such that the health centers and the rural health clinics place these orders for the products through HRSA, and then they can be shared and used broadly with patients served and their communities. So they have a lot of room to decide how to share these in their communities. With the goal is to ensure that these these materials are being equitably distributed across the country, through these various partnerships.
Thanks, Michelle. And I am just looking through, again, please put your question if you have one in the Q&A. It looks like we got a question from someone that asked about, with CARES money running out, what is the plan for future testing, masks, and vaccines? So I can say for ACL, we are always looking for every resource and every pathway to get to our networks. As you all know, after CARES and completely separate and apart from specific COVID relief funding, we were able to get funding from the Centers for Disease Control to our networks to help with vaccine access. We were able to get public health workforce funding out to our networks to engage in hire staff for COVID-related activity. And this is the pathway that we have for our networks to get in-home tests and to get masks. We've gotten a lot of questions from our networks about different ways to get these important resources. And again, the government at this point is providing them free to HRSA's community health centers and rural health clinics. And that's the way we can get you all free tests and free masks. We don't have a way to coordinate and distribute it directly to you, which is why we are really pushing hard on this partnership. This is how we can get resources to the local level. And I'll just say, even beyond tests and masks, who knows what may be coming next? This is a pathway that HHS has to get resources to the local level. And we really hope that you will build these partnerships so we can activate them if and when we need them for anything else. Okay.
And Allison, I was just going to add,
sure, please.
These direct allocation programs, now we do continue to have the supplies available. So I know there's understandably so, some confusion between some of the uninsured reimbursement programs that are ending under the federal funding and then these programs. These programs continue to have the supplies available for now. We have no particular sunset date on those, and I can't necessarily speak, to how long they will last and how long that funding will continue to be available. But health centers continue to order, for the foreseeable future, and it is a separate than some of the. I think there's been a lot of focus on the uninsured funding pool, and this is separate when you see that literature.
Thank you, Michelle. So we got a question. So for our organization to access these supplies, do we have to go through our local health clinics and establish that connection? Yes. So ACL does not have a way to directly have you order. As Michelle mentioned, it is the community health clinics and the rural clinics that have this way of ordering. I think it's biweekly. Am I getting that right, Michelle? With HRSA?
It varies per product.
Okay.
Yeah, now most of the products are actually on a weekly cadence. And, we do have for most of the products, testing in particular and masks, we have sufficient supply available now, really for all these health centers to be ordering at a volume. I think that they can really address the needs broadly in their communities. So if you don't have those partnerships established, we really do encourage you to reach out and make those connections because, we are at a point again now where there is sufficient supply and production available. And we, on our end, are also really encouraging health centers to, think about the cyclical nature of COVID and ensure that, if we are in sort of a waning period, to make sure that they are establishing those partnerships and materials on hand that they can rapidly address, any change in the environment. But yes, I mean, any individual can, you can go to a health center, or if they have an offsite location or they're having a general community, event, you can go and be eligible for these supplies, individually. But yes, to set up that partnership and to receive, a sort of a bulk amount of these supplies, that a partnership should be established.
We have a question, Michelle, that says, do lookalike health centers qualify to be part of this program?
Yes, they do.
Okay. would not-for-profits that service vulnerable adults qualify for a partnership, or would we just access our local HRSA locations? So anyone who is, an ACL grantee, a part of ACL's network, absolutely can. And as Michelle mentioned, the joint letter that we sent to all of our networks has also gone to HRSA's networks. ACL's chief of staff, Rick Nichols, joined a recent call. So they know who y'all are. They shouldn't be surprised when they hear from you. And as Michelle said, actually, we get some of her weekly updates that get sent out, and it's on the list of these are partners we really encourage you to work with. So again, if you are an organization that, is a grantee, is part of our network in any kind of way that meets the needs of older adults, you absolutely can have that partnership. Okay, next question. Can we get tests and masks in bulk from these clinics? I think that is the goal. So, not just to get a pack of 10, but to get to get what you need. But I suspect it probably has to do with what supply there is. But Michelle, anything you want to add to that?
Yeah, I saw a few questions to this effect. I think how and what health centers can share. Health centers do have discretion. They do need to meet the mission of health center work generally and the goals of this program, and in ensuring that they are equitably distributing these, and they do have to make those decisions, right, based on their resources. And understandably, there are some staff constraints here. We have tried to make the ordering process as simplified as possible, and really try to reduce the burden on health centers in regards to reporting. But this does require staff's time to accept these, divide them up, and so I think those are factors they look at. So not providing any advice here, just personal thought. I think any way to help collaborate with those considerations in mind are certainly welcome from the health centers, but they do have discretion in how they provide these. But again, we are sharing with health centers as our supply allocation has increased, that additional amounts are available for ordering if they would like to.
Okay, a couple more questions. I know we only have 5 more minutes, so I'll try to get to as many as I can. And any additional ones we can work through the ACL centers. I think to the same point, this really goes to Michelle, what you just answered. Is there a maximum amount that can be ordered? That really is going to have to be worked out with the community center about what they can accommodate. But again, the goal is to meet needs. A question is, can N95 respirators and home tests be filled for long-term care ombudsmen? I think, again, if the ombudsman would like to get those, through the HRSA health centers, that's fine. To the extent the question is about if you are going into like a nursing facility and about getting it to staff there, I think there's a separate pathway directly with nursing homes. So this is really for the community side pathway, but absolutely for the long-term care ombudsmen themselves. Again, any of the grantees. We had a question about clear masks. And I don't know if there are any in the stockpile. Really, this is about a whole huge set of purchases that happened at HHS that then get pushed out. I'm not aware that there are clear masks in the stockpile, but Michelle, if you could answer that.
Yes, that's my understanding as well, Allison. HRSA doesn't really have choice in the masks types provided. All of the masks are N95 masks that meet CDC's requirements here, and it is a mix of adult and pediatric. I don't believe any of them have been the clear masks, unfortunately. And we don't have the ability to choose or select other types at this time. Okay.
So someone asked, they have a great relationship with their community health center, but they're overwhelmed. Is there a way to get the funds directly if this question was to AUCD and have them give them to AUCD units? We don't have an ACL any funding for this. We really appreciate that HRSA has allowed us, and frankly, I think their pathways through the Department of Defense and our Assistant Secretary for Preparedness and Response. We saw this going out to communities, and we found a way to get our networks to be included. None of us have any specific funding to give to folks. What we have is really this opportunity to create these partnerships. So again, if people are interested, this is the way we can get to you at the local level, masks and tests. So just to verify, AAAs can develop partnerships with the clinics to obtain test kits and masks. Yes, we are asking at the individual grantee level, so your specific AAA, your specific SIL, your specific long-term care ombudsman program, to reach out to your local community health center and start to work on that. Okay. Okay, someone asked, it looks like their local health center only has masks. Can you help us get tests? Michelle, as Michelle mentioned, these are optional programs that the health centers are participating in. We are all encouraging everyone to participate in everything, but ACL does not have a separate way to get folks tests other than through local health centers. Michelle, I don't know if you have anything else to add on that. Maybe people can look if there's more than one health center in their area.
Yeah, that's a great idea. I mean, I will say if they're ordering masks, they have sort of the onboarding steps to order tests, but it is their choice. But that's a great idea to sort of see if there are other health centers in your area, or if there are other sites in your area. Health centers might be ordering these to a parent location, and maybe that site is not yet receiving them, but maybe they have a parent organization that they could pull them from, or you could then directly work with instead of the site.
Okay, great. I know we are hitting our half hour. I think I got most of the questions. If you do have any additional questions, feel free to reach out to the center director who oversees the particular type of grantee that you are. And so we really hope that people will reach out and start to build this partnership. Please feel free to let us know how it's going in the letter that we sent. And I think Anna put that in the chat. We included, I think, an email address to reach out to us if you have questions. And we really appreciate everything people are doing on the ground to keep people with disabilities and older adults safe. And Anna just put the link in to the joint letter. And again, thank you everyone for joining today. Thank you, Michelle, to you for your presentation, and to all of the leadership at HRSA for your partnership. And thank you, everyone.